This is Shelley Kraft. We're coming to you live on SNNLive. We're at SEMDA, the Southeastern Medical Device Association 2014 conference here in Atlanta, Georgia. I have with me Dr. Elizabeth Ofili from AccuHealth Technologies. It's a private company. Elizabeth, welcome back to SNNLive.
Thank you very much. I'm so glad to be with you again, and thank you, Shelley, for having me on.
Now, let's get right into it for those who don't know AccuHealth. Tell us what the company does, please.
So AccuHealth Technologies actually develops technology that helps individuals manage their chronic illness, and it does that specifically by providing a way to quantify health. So anything that's physiologic that can be measured, we're measuring by using a mobile platform, which is on our cell phone, both an Android as well as iPhone. And blood pressure can be monitored all day or however often you want to. It goes directly through the device and it records what comes back to you as an actionable data. And over time, this actually allows every single patient with a chronic illness to understand for themselves what happens when they eat, when they exercise, when they do different things that interacts with their body.
You know, this is important stuff.
Yeah.
Give me an example of how a diabetic would use it.
Great. So in diabetes, which is where we've actually done most of the testing, we provide individuals with this technology. Right now it's in beta, but they can download it from either the iPhone or the Android store beginning in June. And what happens when they download it is they have a way to basically program in what's going on with them as far as the blood sugar that they measure. Once they take the measurement, it registers on the phone and reflects back to them steps they need to take in the form of a color code: green, which means things are good; yellow, not so good; or orange, not so good; and red means they need to talk to the doctor right away. And these levels of data that's gathered is aggregated over time and stored in the device, so when they go to the doctor, they can share that information. So a doctor's visit becomes not that stressful moment where you're trying to remember everything that happened to you, but you now have data to make that visit really count.
Now, you're really saying it like it is for people who need to record this information. What's your background?
So I'm a cardiologist, actually, and I have many patients with diabetes and heart disease in my practice. And I got into this because it occurred to me after talking with a few patients, providing them with a way to measure their blood pressure or their blood sugar, and and asking them to do this as they run different activities, and patients coming back and go, I didn't realize, doctor, that when I go for a walk a mile, my blood pressure can drop 10 points. It provided that feedback was powerful in terms of what the patients were able to do, but also sort of more taking control of your own health. I think we're to the point now where patients ought to be at the center of care. They ought to come to the doctor and go, look what happened to me since the last time I saw you.
So your devices, your technology is really empowering the patient.
That's right. Absolutely. And we have tested it in about 350 people now. Very exciting in terms of the outcomes of them being able to better manage these chronic diseases.
And does it also follow the meds?
Yes, there is a medication piece of it, and it doesn't matter what the chronic illness is. That's driven by the prescription that the doctor writes. And then once they take it from the pharmacy, instead of having all this paper stuff, basically you can get that direction inputted through the app, but also have a caregiver or someone who may be helping you with this help. You know, it's like a pill box, electronic pill box, but also does things like when you didn't take it, what did you do? I chose to skip it. I forgot. All of that gets documented. So, you can see it for yourself, but someone else who's helping you with this can also see what's going on with what you're doing with your medication. And the good part of it is because this is all integrated, we can link the blood pressure issue with what happened with the meds, with what happened with their physical activity and other diet and lifestyle things. So it sort of gives your whole picture together right there.
What is your website?
www.AccuHealthTech.com. That's AccuHealthTech.com.
Ladies and gentlemen, Dr. Elizabeth Ofili, AccuHealth Technologies, a private company. I'm Shelley Kraft. This is SNNLive. We're coming to you from SEMDA, the Southeastern Medical Device Association 2014, right here in Atlanta, Georgia. Elizabeth,
thank you.
Always a pleasure.
Thank you so much.
You're welcome.
Wonderful.